Hi, I'm Dr. A P Nirmal Raj. I've done my specialty in prosthodontics and I'm practicing at Premia Dental Care, which is at Nandi Durga Road. Yes, tooth replacement is absolutely necessary when you lose it. Usually patients lose their back teeth more often than their front teeth. So when they lose their back teeth, usually patients have other molar teeth and the premolar teeth with which they are able to eat, and hence they don't report to the dentist for replacement quickly. So I would say that you need to replace the teeth as soon as once you lose the teeth, once the healing occurs, you need to go back to the dental clinic and get the tooth replaced. If you do not replace, what would happen would be that the teeth tend to move. If you see in the clinical dentistry, a lot of patients lose their lower first molar. When you lose lower first molar and you don't replace it, the upper molars start slightly moving downwards. That is called as supraeruption because it does not have an opposing teeth. So the upper teeth starts coming downwards. The same way, the lower teeth, the second molar, if it does not have anything to contact, it starts drifting mesially or it starts moving mesially. So the space that was available for replacement gets compromised. Hence, it is a must that we need to replace the teeth, whatever that we lose, once the healing is over. You may have lost your teeth because of caries or because of periodontitis or because of a trauma. Whatever be the reason, it is a must that once the healing occurs, you have to get your teeth replaced. And if you do not get it replaced, once the teeth start drifting and moving, your occlusion starts varying. And once your occlusion starts varying over a period of time, you may start developing some amount of pain in your temporomandibular joint because of your varied occlusion. Hence, my recommendation would be that anyone who gets their tooth lost must go back to the dentist and get it replaced. Thank you.